Welcome to Canadian Herpetoculture Podcast. My name is Brandon Milsham.
And I'm Kiana Fox.
Good morning, everybody. Welcome to episode 6 of Canadian Herpetoculture Podcast. Today we got DR.Kelsey Chapman of Calgary at Avian and Exotic Vet Clinic, and she is here to answer a bunch of our questions that we have related to reptiles, quarantine, viruses, different medical procedures that she's done. She's done some for me, and she's done lots of other surgeries for other people in the city as well.
Good morning, everybody. I'm not Dr. Chapman.
No. We'll be adding her right away. So this should be a really great educational episode. I hope to learn more about quarantine and get an explanation of why it's important for everybody to quarantine their animals when they decide to get new ones for their collection and all that kind of stuff. So
and bad viruses.
And bad viruses and proper disinfecting protocols and all that kind of stuff. So this should be a really great episode, I hope. And if you can't tune in now, you guys can tune into the video or the podcast episode, because we'll be uploading the audio to our podcasting site. And I'll introduce Dr. Chapman.
Hello.
Good morning.
Welcome.
Good morning,
Hi.
Kelsey.
Good morning. Thanks for having me.
Thanks for coming on. I think this will be a great episode, especially lots of educational information for people that don't know all about some of the questions that we have.
Sounds good to me. I'm glad you guys are doing this. I really like that herpetoculture is becoming more popular, because obviously we all know they're really cool animals in the wild, and they're also really good pets. So I'm glad I can be a part of this, and I can answer some questions you have about how vets fit into herpetoculture and keeping them as pets.
Yeah, and why vets are important too. Because that seems to be one of the things that, especially in reptiles, I find that first-time owners don't think of is how much a vet visit's going to cost, and where a good reptile-based vet is.
Yes, they are harder to find. I think there's several vets that will see reptiles. In Calgary, I know there's a few. But to do them all the time, I think you get a little bit of an advantage, because you just see things, you get pattern recognition better. And then as going to all the conferences, so every year I go to the exotics conference, and you meet the best reptile vets in the world, so the ones that have written the textbook. And having them on speed dial is, I think, an absolutely invaluable tool, because they've seen so much and they know so much, and they've read all the papers. And as much as I can read all of them and keep up, they always have a little bit of an edge, I think. So it's good to have them as friends.
Oh, absolutely.
The more brains, the better everything functions. So
and also,
there's so much to know. It's just, you got to know where to look if you don't have the knowledge right away. But it's so much easier. It makes your day so much easier if you have the knowledge in your head already.
Exactly. And also with a lot of other vets that don't specialize in reptiles or exotics, they mean well, but they don't necessarily know the best practices to help that animal.
It's hard. There's so many species to know. I mean, just in reptiles, but if you think of adding dogs and cats onto it, and everything else, it's crazy how much you have to know. So I understand if they don't know everything, because they spend most of their day doing other things, and that's okay as well. The word specialist is a hard one. I think when you call clinics and they say, "Oh, we have the exotic specialist on," we get sensitive about that word, because you're supposed to be board certified to use the word specialist. So we are an exotics exclusive clinic, because no one has yet written their board exams at our clinic. I think we all have our own areas that we want to. Like, I know Dr. D.K. Bellis is really into birds. I mean, I love all the critters. It's great to see all of them. I think I love reptiles the most. But she likes birds. Dr. Materi loves the bunnies probably the most, and the mammals, and then I'd probably do reptiles. So it'd be a really cool, diverse area if we could all get board certified. But people will use the word specialist, I think, loosely.
Okay.
So that would be the only thing to be careful of.
I will be bringing my bunnies to you.
Does it take a long time to become certified for the board and everything?
It does, yeah. So if you choose not to do an internship and a residency, which I didn't, I got out of vet school, knew I wanted to do exotics, went right into exotic practice at Calgary Avian. And you have to do 5 years of being an exotic vet and having an extreme caseload. So I think it's like 15 or so reptiles per week. Don't quote me on that, but I think that's what it is. And then you have to write all your case logs for what you've done, and you have to have published papers. So those take a long time to do research and to publish papers. And then you have to sit your board exam. So you have to challenge the exam. So that'd be something that I'd really like to do. It's just a matter of being a business owner and running a business, being a vet, and trying to do something where there's not as much learning. Like there's only really one big conference a year for me to go to. So all the learning in between is going to be self-directed. And then on top of that, finding time to do research and write papers and finding the money to do research too. So it's just not enough hours in the day sometimes.
Yeah, it can take a long time to get all that accomplished. So, yeah. So what got you into doing reptiles and becoming a vet?
I grew up an only child, and my mom worked a lot, and I had a one-parent household. So I think I was alone a lot at home, and what I often did was spend time with my animals. And I've always had exotics. I had mice and newts and fish and everything kind of random growing up. And I always knew that when I was in vet school, I would be the one to get out and I would do exotics. I didn't know I would do it all the time. Like I was leaning a little bit towards doing mixed practice and doing cattle and horses and all that and living in the country. But then after I did a rotation, so like an externship at Calgary Avian, I knew there was nowhere else that I could be, and I could see reptiles every day. So
that's awesome.
It naturally took hold.
Kristen says your office treated our Mellor's chameleon a few years ago, and you're amazing and took the best care of him.
Great, that's awesome.
So that's great to hear that people have good reviews about you. So I had surgery from you guys.
Oh yeah, you did. Go on.
Yeah, I had surgery from you last year for our Tegu, and it did really well. We got different results than what we expected, so I'm pretty happy about that.
Yeah. All I can say is as long as the animal is as best taken care of as we can, to me the outcomes are just an interesting side effect. So I don't know if you wanted to talk about your Tegu now or if you wanted to do that later. It's totally up to you.
Since it's brought up now, I might as well do it. So he ended up, I think, breaking his tail. So he has a basking spot that he would climb up to. I stopped him from doing that by putting a board up there because he would climb up there, and he was using his tail to kind of push him up. So what I think happened is after so long of doing that, it probably caused trauma to some of the blood vessels, and causing blood flow to stop from going towards that portion of the tail. And it started rotting from the inside out. And then we thought he was shedding his tail, but it was skin the inside of his tail rotting and the skin falling off. So we immediately got a hold of DR.Kelsey's office and got booked in as soon as we could. And he had to get tail amputation, so that was the best option for him to not get a big infection or anything else like that, so he wouldn't die. So the surgery went really well. They ended up closing it up. It looked really good, but after I think it was about 3 months, the close up actually fell off because he was regrowing his tail. And then with Tegus from some of my research, and I believe some of Kelsey's research, that adult Tegus don't regrow their tails because they don't need that function anymore. So that was really surprising to see that an adult Tegu was regrowing his tail. Yeah, we can post pictures from the surgery and post-surgery now. He's got about 6 inches of regrow, so it looks really fantastic. Mm-hmm. And we will post those up later.
Yeah, it's good. So for his, I mean, he came in and the tail was necrotic, so it was dying. And I think that your thoughts on what happened are probably what happened. I mean, there's no way that we're going to know now. Yeah. But the tail autotomy is a great thing in the wild because you can lose your tail fully and not bleed to death. And then grow it back and be able to do it again. It's an amazing adaptation. But the worry, I think sometimes, and I think I've seen this probably happen in captivity more, is that they maybe hit it a little bit. So it's almost thinking that it needs to drop the tail, but it doesn't fully drop it. So the blood supply stops because it thinks the tail's going to go. Okay. And it doesn't go. Now you have a necrotic bit to the tail. And I wonder if that's painful. I don't know. It would be hard to tell, I think. Right now,
they don't really show signs of pain very much.
They're not as good. They'll react in a similar way. But another reason why is a total aside. Another reason why pain control is difficult in reptiles is because it's really difficult to study. This because a lot of times they use heat, And sometimes, as we know, like say you have a snake and you leave a bulb in there that you shouldn't, and they wrap around it and they burn themselves because they don't have the same kind of pain receptors mammals do, especially not for heat anyways. But that's an aside. So when he came in, to me, the natural thing would be to amputate the tail. That's the right answer to do. And now where you have a choice as a doctor is to decide, do you or don't you, see if the tail will regrow. Because of where it was, I leaned more towards closing it, and I'd done iguanas recently where I had to close them. Like I had not closed in the beginning, and then they hit their tail again. So I'm like, let's just close this tail. I left a flap on the bottom, closed it up. It healed, looked like it was healing really nicely, but he was determined to grow his tail. He grew right through that flap, and I think the main reason too why I wanted to close it, because if you saw how big that area was, that's a big area to leave open to bacteria. And I know another argument is going to be, it's probably about not that big. Yeah, the argument's going to be, in the wild they don't close it, and that's true. But a lot of bad things happen in the wild too. So hi, Greg. So we can try and mitigate some of the bad things that might happen in the wild by taking good medical care of them in captivity. So that was the choice to do that, but he had other ideas.
Yeah, which either way, I was happy with the outcome. If it was not to,
and then we kept it closed for the meantime, so maybe that was a good enough thing where we didn't let more bacteria come in. He just grew his tail right through.
Yep.
It let enough cells regenerate because it was protected enough, maybe.
Yeah, and especially in adults.
Thing too. We could have bandaged it open, but even for his case, I texted the guy who did the editing for the newest Mater. That's, I don't know if anyone out there is a fan of the textbooks, but the reptile Bible basically is called Mater, reptile and amphibian surgery and medicine. And Stephen Divers. So I texted him and I asked him, and he said, you have two choices. And so I made one of the choices.
I think it was the best choice, because if we did left it open, it would have more chance of getting infected from different bacteria and stuff like that. Yeah. So either way, it worked out in the best case. He's still doing well. He's very food motivated, and I'm just happy he's still around. So
you had him in a hospital type setup, didn't you, for a little while?
Yeah, I had to keep him in a sterile setup. It wasn't ideally the largest setup. I kept him in a Christmas tree tote, but it kept him really clean. It was easy to clean up his poops and stuff like that. He did have proper basking temperatures and UV still. So it was just the easiest way to make sure that he was going to stay clean and his tail wasn't going to get infected.
Yeah, that's the best thing to do when any animal is recovering from surgery. They always want to have them have the best welfare, which is going to mean usually a bigger cage, but to control the temperatures, to control how they're going to heal. And they heal better in their POTZ, right? Their preferred optimal temperature zone. So if you can control where they are in it and you can make it a little bit warmer, you sometimes have to sacrifice them moving around for their healing's sake.
Yeah. Yeah, he did really well. He wasn't too thrilled about being in there, but it was for his best interest and it turned out well. So that's the importance of when you're having to do surgeries and stuff, is keeping the area as sterile as possible. So
yeah, and people that are listening should know too that he was on antibiotics the entire time. He was on a really long course of injectable antibiotics, which was necessary.
Yeah, that was like 3 months of antibiotics, I think it was. If not, I think it was actually longer than that. Yeah, I think it was like close to 6 months of antibiotics every 2 days for the first week.
Yeah, it sounds like a really long time, but reptiles heal really slow. They get sick real slow too, and they get just better slowly. So you just have to support them through the whole time.
It's just their metabolisms are a lot slower than mammals and stuff because they don't need to eat as often and other factors as well.
Too, because they only heal as they shed, right? So it's not a constant healing like we do.
So in adults too, they don't shed nearly as often as a baby would or a juvenile. So it would take a lot longer for an adult to recover from a surgery than it would a younger animal.
Yeah, that's true.
Vanessa said it was almost 7 months for the medications. Yeah.
So were you having to do the injectable antibiotics at home by yourself, Brandon?
Yes, it was injectables. The vet techs would show me what to do properly. And it was in the rear hind leg, I believe it was. Or
front.
Front. Yes, that's right. It was a front leg, and yes, I'd have to do underneath the skin, and he was not a big fan of that, but it had to be done. He took it like a champ. He's a lot easier to do than my snakes. Giving medications to my tegu is a lot easier than the snakes, especially like dewormers or anything that's oral. So that's a lot easier than the snakes. I don't have to stick a 2-foot-long catheter down the throat and have 3 people hold a boa constrictor, because I've had to do that before too.
That sounds like a bad time.
For vets to know that don't do reptiles all the time. It's just knowing what's normal. So I think the first time that a dog or cat vet will look into a bearded dragon's mouth will be really concerned. They'll think this animal's jaundiced, something's wrong. But that's the normal mucous membrane color for a bearded dragon, right? And then
looking into a tokay gecko's mouth.
What's that?
Or looking into something like a tokay gecko's mouth because they're black inside.
Yeah.
So I've had people think that their tokay had mouth rot, and nope, they have black mouths. It's normal.
Yes, that too. And then surgery, so like for chameleons and for bearded dragons too, the mesentery, so the thing that is covering basically all of the internal organs, is colored black. And so for a normal surgeon, you think, oh, that's totally devitalized. There's no point in saving that. We might as well euthanize the animal. But you just have to know that that's normal. Keep going.
Yikes. Sounds like mistakes can easily be made if you're definitely don't have the trained eye.
Yeah, I think that can be said for most things that people do. I think experience certainly helps. But I'm always happy to answer questions too from other vets. So sometimes people can't get to us. Like we have people from BC coming, people from all over Alberta. But if they can't get to us, I'm always happy to answer someone's question, because I'd rather them get good care.
Yeah. To answer Sherry's question, it kind of didn't like me for the first little while, but then after a while he was a lot better, especially after coming out of anesthesia that took like 3 days for him. He was pretty groggy for that, and we had to give him a shot of morphine prior to surgery too, so he was quite out of it for a while, and he was not happy. He was pretty angry, grumpy tegu. Every time you try to go in there, he would start thrashing and opening his mouth and trying to bite you, which was a little abnormal for his behavior. But with him having his tail amputation, he's wounded, he knows that, and so he's trying to be defensive.
Falco's definitely used to being handled and being an animal that a lot of people come up and touch, and he's really desensitized to a lot of that stuff. So to know that he got pretty ornery when he wasn't feeling too good is definitely shows that when reptiles have emotion, like they don't want you to bug them when they don't feel good.
Yeah. And it depends on the reptiles too. Like larger monitors and tegus are really smart animals compared to like snakes and stuff, where they don't have as much processing power.
More like base function or like survival mode function opposed to problem solving.
Yeah, it's but it's been proven snakes are really smart either way. It's just that they portray things differently.
Yeah, they're smart in their own way. I think it's hard to know what it's like to be a snake.
Well, yeah, it's like when they do all these researches and be like, oh, this mouse can do this maze. Can the snake do it? Well, the snake probably can do it, but it's going to be in a different matter. So it's not going to be really the same. Yeah. So, and it's like trying to get Falcor to figure out how to get some food out of something and then try to get the snake to do it. It's not going to be the same kind of test. So
Falcor can figure out one of those puzzle toys. A snake probably isn't going to.
Yeah, exactly.
But a snake will find another means of getting their food at the same time.
Sherry says, absolutely. I went through that with one of my chameleons. After having to do injections, he went from loving to having a hate for me. He knew I meant pain because of that needle. And yeah, because sticking that needle's in, depending on the animal, some animals have thicker skin. The Falcor, he has really thick, dense skin, so getting that needle in there was really hard. You had to put quite a bit of force into there compared to doing it to like some of my snakes, where it goes in a lot easier because the skin's not
easy too. I think a lot of people don't want to have their animal associate them with pain, so they'll choose to have us do the injections, which is totally fine, but they just have to come back every 2 to 3 days, right? Because that's how often the antibiotics given. But we do them in our clinic too. We charge like a nominal fee for it. I think it's like maybe $50 for all 12 or however many injections there are. But because it matters that they get it. And if people are uncomfortable with needles too, sometimes it might not just be about their pet. It might be that they don't want to have needles in their house, which is acceptable.
Yeah.
Yeah, completely.
Yeah, like right now we got quite a few needles in for Elvira for her abscess that Kelsey actually lanced on Monday for her nose. So we have more injections to do.
That's a pretty common place for an abscess, and I haven't read any papers recently to tell me exactly why. Maybe because, I mean, that's where they attack their prey. There's maybe more cell damage that happens, or it's easier to get into the tooth. But
I think my issue is she previously cut her nose open there, and it was big wound for a while. So I think there was bacteria that probably ended up in the scar tissue, and then eventually just flared up. So
or rubbing too can cause abscesses to start there.
Yeah, I received a boa a couple of years back, and he had an abscess on his nose from rubbing. It eventually fell out, and he had this big crater in his face, and it was gross. But now he doesn't even have a single mark on him.
Awesome.
Like it was probably a centimeter wide hole in his face, basically, but it completely closed up. He has no deformed scales on it now. Everything looks perfect. You wouldn't even know that he had an issue at all. It's amazing how well they heal.
They do. I have a ball python that was rescued, or I'll say it came into the clinic and someone wanted us to fix it, but he didn't want to have it anymore. And so the option there is, if it's his and he brought it in, he can euthanize, or if any of us have room in our houses, we'll usually take them. But don't think that you can just drop off animals at our clinic. We're all super full right now. But this in particular, she burns all the way down her ventrum, so all the way along her belly. It looks like heat lamp burn, likely. And she doesn't even have a hint of a scar. And it was all the way down to the muscle. It was a high degree burn. And if a human had that, they would have scars everywhere. But she looks like an absolutely normal ball python now. So it's crazy what they can do.
They're so resilient, and it's really unfortunate that human error can go that far with them. Yeah. But it's absolutely fantastic how well that they can bounce back with proper care and correct husbandry.
Yeah, exactly. Husbandry is so much. I always say, I can say this a lot in the exam rooms, where people come in with something that hasn't been eating for however many months, and we go over husbandry, and I say, you need to fix all of these things. There are so many things wrong, and they just want a pill. And I have to say, I don't have a pill on the shelf that will fix bad husbandry. I don't. And even if we were to give your animal an antibiotic, if you don't have POTZs properly at home, if you don't have humidity gradients and light gradients and proper UVB at the right distance from the animal, they're never going to heal. There's no amount of antibiotics I can throw at them that's going to fix them.
Even when people post on Facebook like, hey, my ball python isn't eating, first question people that are trying to help ask is, what's your husbandry and your setup like? And people always come back with, everything's fine. All my temps are fine. They're perfect. And it's like, well, your ball python would likely be eating if they were. So if you could just cooperate with us, we might actually be able to help you out a little bit and get this problem sorted.
The same answer. I say, say take a bearded dragon. What are the temperatures in your enclosure? What's your temperature gradients? And they'll say, oh, it's pretty warm. That's not.
And,
do you have a thermometer?
And a lot of
thermometer, 40 to 43 degrees Celsius is hot.
Yeah, and a lot of new time keepers usually just get those stick-on temperature readers, and they don't understand that the surface temperature and the ambient temperature are two different things.
Yeah.
And that's a lot of misconception that people don't understand, because when they're buying from a big box pet store, sometimes those people that are selling those animals don't know either. So. Yeah.
They don't, and it's hard, but that's an entry level job, and sometimes you'll get really great people that know what they're doing there. But even some, I'm probably going on a controversial limb here, but that's fine.
We do that.
Things like I don't want to misspeak. I don't remember if it's Exoterra or if it's Zoomed, but they have the moon bulbs for nighttime.
Yeah,
and the bulbs too, which I don't understand. I mean, a moon bulb is like putting off bluish purple light, which is mid wavelength. That's got to be extremely behaviorally confusing for an animal that takes so much of their cues from the environment. So I remember talking to one of the reps and saying, "Why do you have these?" And he was a herp guy, and he's like, "I don't know." I'm like, "Stop selling them." The red bulb too. Okay, that's fine in the daytime, sort of. But where in the world is it red all the time?
Yeah.
Like
Nowhere.
sun for an hour, maybe, but definitely not at night.
Sherry asked, how do we stop rubbing? My hognose loves to rub the doors of our unit. I've added a lot of climbing surfaces and 2 sections of substrate, part aspen, part soil.
My mother-in-law's watching.
With plants, so she has a lot of burrowing options, yet she still rubs on the door. That's a great question.
That's hard.
Some animals, especially some snakes, are really visual animals too, so they love to try to see what they can get out at. You probably could block the sides off of it. I've tried, I haven't actually tried this yet, but I've been thinking about, for some of my snakes that love to rub on the door, about putting window tint film on, so I can see in, but they can't see out. So that might deter them from wanting to look out the window because they can't see what's out there. So
Yeah,
that might be something to try.
people would reflect and they'd see that.
It depends on which kind of window film you'd get. I wouldn't get the reflective one, so probably just like a really dark one so you can see in. But
You can get opaque ones.
Okay.
Yeah. So I haven't tried that yet, because some of my snakes actually stopped rubbing so much. So I've been thinking about trying that with the ones that do rub a lot. So that's an option. I've been thinking about it, but I haven't tried it yet. I think it would work because they can't see as much.
With my Maclots, she's young, so she's really, really defensive still. I can just be sitting in here on the podcast doing this, not even moving, and she's just striking at the glass like crazy. So I have 3 sides of hers blacked out, and now we can actually sit in this room without her freaking out. Sometimes we still have to cover the front of the enclosure because she's just extra excited, but blacking out a couple sides definitely helps, in my opinion.
Cody says the white window security film works great and doesn't reflect, so that's a good option for people who want to try that.
You can do different things in terms of enriching the environment as well. So adding new things, adding new toys, things to crawl through, things to
different smells.
But it's hard because they come from the world where they have a way bigger environment than we put them in.
Yeah.
It's hard. I have 4 reptiles of my own. I know that the tanks that they're in are smaller than what they'd be in their natural environment. I get them out when I can, but as soon as you take them out, they're at room temperature too, right? So it's hard to have everything perfect, but we do our best, I think.
Yeah.
So, as far as outside time of the enclosure, I guess, what would you say is an okay length of time before their body temperature is going to drop too much? I guess for our pleasure. Yeah.
The hardest thing about that is that you have to wonder at what point is it going to do them harm. So they can go through different temperatures. They can brumate at temperatures that are colder than they'd normally be at. And it might not necessarily harm them if they're out and they're chilly for an hour, but we don't have all the evidence for it. So what I try to do is I try to limit it to 30-minute intervals, depending on the size of the animal. If you have Falcor out, if you have a large Tegu out, they're going to get colder not as fast as if you have a small animal out. But letting them, imagine living your life in a tank. You have your idea of spatial recognition, I feel like, would be totally flawed because you're living in this 4x2 or even smaller area. So getting out and being able to at least look around and be more comfortable with that, I think it might, I would think, change their brain in some way. But like I said, I don't have all the evidence for that. But I do maybe 45 minutes max, but I keep mine open for 30, and you can do it a couple times a day and let them go back in and warm up again. The longer they're at something that's not a preferred temperature, the more likely you are to have complications.
And especially if you feed them beforehand, it's not ideal either, because you want to give them an ample amount of time to properly digest foods, because they need that temperature to get their body up to whatever core temperature they need so they can digest and do proper bodily functions.
Yeah, and healing from sickness too. Like, we can make a fever, they can't. They just have to. You have to provide them with options for what they need.
Yeah.
So that's a huge thing with sick animals. Is I'm reluctant to try and fix something if the husbandry isn't good. Like, I will at least warn them. I'll say, I can do everything that I can, but if you go home and they don't have a high enough temperature in there, their immune system will not work.
So that kind of sparks another question of mine. People bringing, like, it's spring now, even though it's snowing sideways where I live in Alberta. As temperatures start to rise, people start bringing their animals outside. It's like 15 degrees Celsius. A lot of that's way too cold for a lot of reptiles. And so what would you say is a safe temperature? Well, I guess that's going to depend on species for what a correct temperature outside it would be. Would you advise taking your reptiles outside because it's going to be harder for them to do stuff like thermoregulate when you're out there holding them, and there's a whole bunch of different factors.
It also could be an over visual stimulation too, because there's different light changes, there's different smells, there's so much different things. There's birds overhead that are flying. So,
I mean, small increments is a good thing to do. I think there's nothing better than natural sunlight. We cannot recreate it in captivity. We are limited in, I think, the species that we can keep in where we are, like in Alberta, which is unfortunate because I'd like to see a lot more even cooler things. But I would say that if the temperature isn't in their POTZ, I wouldn't take them outside unless you have some form of external heat, like you're bringing a heat lamp out with you, or you're making sure that you have them on a heat pad, but still a heat pad's going to heat their belly only. And your body temperature is not enough. A lot of people will say, well, he's on my chest. And I'll say, you're not warm enough for him, and you're not keeping him as warm as he needs to be.
Yep.
But I would say wait until the temperature outside is within their temperature zone. If you have them outside in a self-made tank, make sure there's places for them to hide, to get cooler, to get away from the sun, to get away from visual predators like birds flying around. I know that freaks my breeder dragon out like nothing else. So I wouldn't recommend doing it unless you have something to take their core body temperature. And I don't think anyone's bringing a rectal thermometer, thermometer with them. So I'd wait until it's proper outside.
That makes sense.
2 months of outside time with ducks. But.
Yeah. I don't think I'd really take much outside for what I keep, except for maybe my boas. So everything else will run off too fast.
What's the most common ailment in reptiles that you usually see, or that comes in the most often?
Let me think. Well, husbandry related things, which is actually a pretty broad category because so much can go wrong with poor husbandry. I think. Well, so stomatitis, so mouth rot, is quite common. The colloquial term is MBD, metabolic bone disease. That's not the real name. The real name is either nutritional or renal secondary hyperparathyroidism. And so that's when you don't have adequate calcium supplementation or not adequate UVB, or you have too much D3 supplementation, and they can have problems that arise from that where their bones are quite soft. Those are all quite common, and it's all for the most part, because of husbandry not done properly.
So husbandry usually is the problem, and then people bring you in for secondary issues.
I'd say husbandry is definitely the number one problem in reptiles. It's us.
Yeah. So it's keeper error.
Yeah. And reptiles get sick just like mammals and stuff do. And I see a lot of those cases where I have to do regular surgeries on them to try to fix what's going on, or do antibiotics of no fault of the owner. But sometimes it's just keeping them in captivity. Even if we do the best job, sometimes it's still not perfect. Like it's still not sun,
Yeah.
What are some of the common viruses found in reptiles?
Viruses and diseases, yeah.
Yeah, viruses and diseases.
I know
we know a couple.
I know there's nidovirus, there's crypto, there's IBD.
Cryptosporidium isn't. Yeah. So it's more like an internal kind of parasite-y thing.
Oh, okay.
But there are a couple. So there's quite a few viruses. So many viruses can affect reptiles. A lot of ones that we hear of in mammals, but they're species specific for reptiles. Yeah. For the most part, the most annoying thing about viruses, and I think it's probably similar in human medicine, is that it's not as easily curable as bacterial infections are, because of doing an antibiotic is going to help kill the bacteria. As long as your immune system is still there to take away those dead bacteria, then you can help them. The biggest one is probably a good idea to mention, because there's a lot of new research being done on it, is IBD. Have you guys heard of inclusion body disease?
Yeah.
So we think this is caused by a virus. We think that boids might be natural carriers of that virus, meaning that they don't get that sick from it, or it takes them a really long time. So I found it in boas that have come in for routine checkups, routine blood work. We do the blood work, we see inclusion bodies within their cells. So we know that they have this disease. Now, the main thing with keeping mixed collections that I worry a little bit about is that pythons are more susceptible to it. So they die much more quickly. So if you are to infect boas and you're going to infect pythons in a research scenario, pythons often die within a matter of months, whereas boas don't seem to be affected that much. So that's the main thing is I would go to your pythons first and then to your boas after in cleaning terms and just do as best biosecurity as you can in terms of that. But then the question is, so a lot of boas will maybe naturally carry it and have this virus and this disease, but they may not show it. So say you're being a really great keeper and you take all your animals in, you do all the blood work that you can, and you find it in one of your boas. Do you call your whole herd? I don't think so. But because if you hadn't looked, you wouldn't have done it. But it's a hard thing because it can be passed between mother and babies. It can be passed in copulation. It can be passed with secretions between animals. So it's something that we just need more information on before we decide what we're going to do, I think.
Okay. There's a couple comments here. Mark, do you find many that of reptiles you see are severe because reptile hides ailments so well and that the owners are uneducated? I think is what he meant there.
Maleducated.
Or yeah.
I'm just reading that on there. Look, many reptiles of severe disease hide ailments. I think it's natural for a lot of animals to hide their ailments, especially if they're a prey species or can get eaten in the wild. It's part of their evolutionary advantages to pretend everything's okay so that no one gets them. But a really frustrating thing for sure in reptiles is that their husbandry is really, really poor. That they must be suffering internally because of it. You can do blood work and see that their kidneys are failing, but yet they look at you and they eat and they walk around. And that's the hardest thing, is to convince someone you need to change what you're doing at home because your animal is suffering, because to them, they don't see the suffering. So it's really hard to just pull on their empathy strings because the reptiles don't act like a dog and cat do. They don't they don't look at you, they don't do the same kind of thing. So I think we have to understand that if we can rationally think about what maybe is happening in their bodies and have some compassion for that, and then going off of what we know medically and biologically and assuming that we can try and make it better, I think that's probably the best thing to do. But that's a frustrating thing because they come in and you're telling them, I think your reptile is sick. I think we should test and maybe fix it in some way. And they say, oh, you just want money from me. And I'm like, no, I really think that it's ill. But if you don't believe me, how am I going to put that value on making sure your animal gets better?
And that's the hard thing too, is a lot of people think vets are just trying to take their money because I think your animal's sick. And it can be the case depending on who you're seeing, but generally, especially reptiles, because it's so specialized and whatnot. So I honestly never have thought of that when I went to a vet. I'm like, hey, I have this issue. It's not that you're just trying to take my money. It's you're trying to help my animal and you want the best for it.
Yes. Yep. It's hard. I mean, it's a hard thing. When we went to vet school, all the vets went in because we like animals. We end up really dealing with a lot of people when you come out. And the hardest thing is they never really trained us to be business people. We all just kind of hoped that it would be just like human medicine where, oh, you might have this. Well, these are the tests to do, and this will help us find out what it is, and then I can totally help fix it. But at the end of the day, budget matters, and I get that. So we have to keep all of that in mind when we figure out where to go. But it's hard because then you end up guessing sometimes. Where you say, well, I'd like X-rays because it would tell me this, and I'd like blood work because it might tell me this. But when they only have enough money for one or the other, then you have to pick. And it's hard because what if you pick the wrong test? At least you rule out some things, of course. Yeah. But it'd be nice if, maybe the government one day would say, hey, animals really matter to human welfare, so let's subsidize their healthcare.
And that's why vets cost so much, is because it's not subsidized like the human healthcare system, where it's a lot cheaper compared to other places and stuff like that. Kristen asked if you ever treated coccidia.
Yes, so you can treat coccidia in a bunch of different animals. So it's an internal parasite that mammals can get too, and oftentimes you'll find it on fecals. The annoying thing about coccidia in some reptiles, so greater dragons, for example, is it's hard to get all of it. Sometimes there's a lot of resistance in the coccidia organism. So you can do certain treatments and then test again and say, oh, it's not quite gone yet. And you can use another treatment and test and, oh, it's not quite gone yet. So sometimes we just try and keep the parasite load down. Like my Beardy had coccidia. I luckily got rid of it, but I still get them run fecals on him every year to make sure, because a fecal can be a false negative. So you can get the results back and look like there's nothing. But just because maybe that poop didn't include the coccidia might not be there. But for the most part, all reptiles and a lot of animals, especially in the wild, will have internal parasites, and that's normal for them. But it is a stressor that we can take away from them when they're in captivity. So we always recommend doing fecals first to see maybe what's there before treating instead of just blanket treating.
And also with some of those parasite loads that are naturally in the body, husbandry, I would think, would trigger some of those. So if the husbandry isn't correct, that means some parasites could overload the system because it has an advantage.
Yeah, basically any kind of ailment that the body can get, husbandry is going to have an effect on if that gets better or if that gets worse.
Okay.
Well,
Sherry was wondering, what are the symptoms of IBD and is it curable?
Yeah, IBD, I think of it as a great imitator. It's sometimes the symptoms are absolutely nothing. So it's a retrovirus. So it's not exactly comparable to something like AIDS, but what it does is it makes the immune system of the animal not very good. So you can just keep getting maybe repeated infections, or it seems like the animal gets more mouth rot than they should, or they come in and they're just sick and not quite eating and not getting better. So really non-specific signs. So that's an indicator to me that would be nice to test. The hard thing about testing, though, is the best way to test is to take biopsies, which is, one, an expensive procedure and risky to do. And two, when you send it off, it's even more expensive because they have to send it down to, I think it's Florida. You can sometimes catch inclusion bodies on a blood smear. So there is a test where I can send it to the pathologist, just take a regular blood sample, and they can say, oh yes, I see inclusion bodies in here. But it's the same kind of concern as with the fecal. You might get a false negative because you just might not have found those cells that have the inclusion bodies in it. And there's no cure that we know yet, of course.
Have you encountered nidovirus? I know that's a bigger deal in the States right now. There's 3 universities that are studying it. I listened to quite a few podcasts where they had some of the virologists from some of those universities talk about it.
Yeah. I haven't encountered it or diagnosed it here in my practice yet, but I have heard that in the States, it's something that's a little bit more of a concern. It could just be that I haven't tested for it yet, because a specific test, like doing a PCR for a certain virus, is an expensive test. And most times I get 1 or 2 options from an owner when they come in and say, okay, maybe I'll do blood work or maybe I'll do x-rays. And adding on a specific test like that, where it's going to give me a yes or no, doesn't give me a very broad range of answers. So oftentimes I'll try and see, like maybe the regular blood work might show that there is immunostimulation. So a certain type of white cell is more elevated. Then I could think, if we did antibiotics and that's not helping, you may have a viral infection, but I can't really fix that. So.
Okay. Yeah, because I was listening to some about the nidovirus, and some of the virologists were thinking if there was going to be a vaccination for reptiles, that nidovirus might be it, because it's a kind of a recurring RI infection in snakes. And they've been finding in wild snakes that the virus is there, but it's dormant in colubrids, boas, and pythons, and it's in native populations. It's just nothing has triggered it. So
yeah, that's a hard thing too, is different species of reptiles, different species of snakes will be more susceptible to the effects of a virus than not.
And there's different strains of viruses too, so they'll affect that animal differently. It might be the similar virus, but it's just a different strain.
Yeah.
So it's
oh, sorry, what were you saying, Brandon?
It's just really hard to treat certain viruses, especially in reptiles, because it costs so much money to research and then develop something for that. If they is a possibility to develop, say, vaccination or something along those lines.
Yeah, I think that's a good reason for for podcasts like this, and for reptile expos and shows where reptiles are shown to be the great pets that we all know they are, because the more attention that we can draw to these species, the more money that's going to be put into researching them, and the more we can do for them medically. Like if you go back 30 years, we did not little, but we did very little compared to now. And now you can do basically all that you can in a dog and cat. But we don't have as much knowledge as dog and cats do, because that's two species. But think of how many species of snake there are. And then
it's vast.
Yeah, there's 3,600 species of snakes or something like that, if not more. So
what are the more recent advances in, reptile veterinary care?
More recent ones. I think they're doing a lot of endoscopic procedures, so you only have to do a very small incision. Yeah, we don't have the tools at our clinic. They are incredibly expensive, and then to do the training is another thing. So I've done a couple things with them, but nothing in my practice yet. And then just people getting innovative. So we used to always have to do plastron,otomies, so cutting into the plastron of a turtle or tortoise to do, say, a spay procedure, or to do some kind of exploratory surgery to look at what's inside or what's going on with their guts. And now with some turtles and tortoises, we are doing a lot more incisions in a prefemoral fossa. So like the hind leg, where that little fossa is, where their little legs go in, you can make an incision there, and you can spay them. So if they're, you can help them with their egg bound, and you can take out their ovaries if they seem to always have laying problems.
That's really interesting with turtles, because like they're little tanks, and you can't really remove the tank to go in and do a surgery. So that's actually really cool that you can just kind of pop in that back area. To go back
on to some of the virus stuff, I find this a big deal with keepers and breeders is when some breeder gets a virus, and then everybody thinks that person is a terrible keeper because they got a virus. But a lot of these viruses are known now to be dormant in species. So I don't think it's necessarily bad that people get them, but it depends on what those people do to treat or prevent these viruses and diseases, because there's different ways to go about that. Like sometimes you might have to call off certain amount of animals and then keep testing to make sure that you don't have that in your collection anymore, or some other precautions, but it would be up to the vet's discretion and your discretion as well.
Yeah, it's always going to be a conversation too between the vet and the keeper to know what the best thing is for them and for the animals, and then it's up to the keeper to know, to be honest with the peers, and I think it's up to us to spread the right knowledge about these viruses, and to say, hey, these aren't necessarily people's faults, and they're really hard to test for. So it's nice the more knowledge, I think, the better. And I think that as long as we can understand that we're all trying to do our best, I think making sure that we first assume the best of someone, and then after that, looking into the facts.
Yeah, because that's kind of one of the purposes I want to do with this podcast, is like with viruses and stuff, because they're so misunderstood, and people just are automatically to point out that, like, hey, you got IBD, you're a shitty person. Yeah, no. And that's not necessarily the case.
I think if people are willing to take their possibly sick, infected animals to the vet, get the required testing, and be open and honest with the community that they're involved in, that they could have had interactions and stuff like that with, as long as they're doing the veterinary care and testing and being forthcoming, I don't see any issue. Illnesses happen. They happen. If we could prevent them, I'm sure we'd prevent them in ourselves as well.
Yeah.
But as long as you take the necessary steps, I don't think you should get lynch mobbed for it.
Yeah, I agree too. And I think it just promotes a culture of hiding too. If there's something wrong with one of your animals, and you don't want anyone to know about it, you might hide it, or you might just euthanize it. So it'd be nice to know that, we can make these things better. Sometimes we can figure out what they are, and it's nothing to be really ashamed of that your animal gets sick.
We have a lot of really good questions.
When you have sick animals, I was actually going to get to this. And when your animals are sick, do proper quarantine, or even when you get new animals too, because you don't want cross contamination, which goes into some of our questions here, because you want to quarantine those sick animals away from your collection, and you want to do those animals last. So then you're not doing cross-contamination. So if you do those first and then you go do your other animals, you have a higher chance of getting that bacteria or viruses or whatever.
Or have your own tools for your quarantine room.
Yeah.
Yep.
So Cody McMillan here, does Purell actually stop cross-contamination when cleaning enclosures or handling different animals? That's a great question.
Yeah. So for a bunch of different kinds of organisms, there's going to be different things that are it's susceptible to. And each one of those, so either fungus or virus or bacteria, is going to have a different range of things that it's susceptible to. So Purell, I think the active ingredient is just alcohol, like rubbing alcohol.
Mm-hmm.
Pretty good for most things, but it'd be good to research that exact thing that you're trying to kill. Like say you have yellow fungus. One of the best things that you can use for yellow fungus is bleach. But bleach has a contact time. So you can't just spritz bleach on and then wipe it off afterwards. You need to use like a 10% bleach solution that has to sit for at least 10 minutes. So it's not going to be a blanket treatment for everything. But I think that, yeah, either you can contact your vet or go in and ask about the specific organism, or if you have a way of looking up research papers, they're still coming out. Like that yellow fungus paper was presented at the last conference, which was in September. So we still don't know some things about what it gets and what it doesn't.
Yeah, that's very interesting. Sherry asked, something I've often been concerned about is transmission of a possible parasite from the reptiles to my dogs when I'm cleaning a unit and some soil hits the floor. Is this something I should worry about?
I think the main thing transferring between reptiles and your mammals, salmonella is pretty huge. Salmonella, we're assuming that most reptiles carry it in their feces, which is normal for them. It's not something that you necessarily need to treat unless it goes somewhere else in the body. So that would be the main thing, is not letting them transfer that from the feces of your reptile into the mouth of your dog, because that could make them sick bacterially. But usually parasites are quite species specific. So worms, coccidia, those kinds of things will often just infect the animal and the species that it's working with. So it's a different species of coccidia that goes to other animals. But for the most part, just to be safe, have your dogs put away when you're cleaning your enclosure, or make sure that anything with poop in it gets put directly into the toilet or into the compost, however you do your...
Or the wash if you get covered in shit. That happens to me often.
A lot of things, and soap.
Brandon's always covered in poop.
Yeah, some of my snakes are just shit helicopters. Vanessa was wondering, what's the proper way to quarantine your animal with illness, or just if it's a new arrival?
So there is not going to be a black and white answer for this. I think a lot of zoos do at least 3 months of them being completely on their own and going through, like, zoos do an incredible amount of testing because they can.
Yeah.
And because there's a budget, of course, but it's usually quite high for the bigger zoos. So they do all the testing of the things that they know can often get transmitted between that species before, and then they watch them for 3 months. Because like I said, reptiles get sick quite slowly. So by the time they show signs, which might be never, it might be too late. So the quarantine thing, I mean, 3 months I think is a good rule of thumb, but it's certainly not a black and white kind of thing. I would say the biggest thing we can transfer between animals, fecal oral transmission, so parasites that way. So getting the feces tested is a great first step within new.
Cody McMillan is wondering, is there anything an experienced keeper should keep on hand that you wouldn't necessarily think about?
It's hard. What do you guys think about?
Well, like Brandon and I just picked up Virkon.
Yeah.
For some sanitizing.
It's pretty good.
Yeah, you suggested it to me, so I picked some of that up. I personally keep a small first aid kit for my reptiles. Like when I brought Falcor in, I had his tail wrapped up the best that I could anyway to prevent further contamination and whatnot. So, and also my tegus are klutzes, and sometimes they get open cuts. So I have a spray-on bandage that kind of covers it up and helps it stay clean. Some polysporin, because I know regular polysporin is supposed to be safe. You don't.
I only shy away from polysporin sometimes because of if they
lidocaine.
Lidocaine Yeah, I mean, depending on how big your animal is, there is definitely a toxic dose of lidocaine. It's different for each species.
Okay.
But just some animals are more susceptible to having those antibiotics go orally. But like I'd say this is more of a worry in, say, rabbits than necessarily reptiles. But there are some creams that you can get that I think might be pretty good. I'm not sure if they're over the counter though. Like we use a lot of non-toxic ones. We use flamazine a lot. It's silver sulfadiazine, and it's something that we use in human burns. So
yeah, I've heard of people using those for snake burns quite often.
Yeah, and then cleaning's a big thing. Soap does wonders. So soap, and then maybe having a dilute iodine solution is a good thing at home for minor cuts. The main thing is knowing what to look for. So swelling around the area afterwards, any decrease in appetite or lethargy in the animal is always a concern that something is going a bit wrong. But like if it's more than just a little cut, it's not bad to take it in. It's just just call your vet and see what they say. But they can't. Do remember they can't give advice over the phone.
Over the phone, yeah.
Yeah, COVID's a bit different, but I'd say my patients are hard. Like it's not like a typical dog and cat where they show signs the same way. And if I don't have hands, I feel quite blind.
Yeah, I feel like a lot of time people like call vets for not necessarily advice, but like, is this something that I need to bring in? Because they're worried about cost.
Yes.
So it's like, how serious of an issue is this? And you can't really gauge that over the phone.
Yeah.
Sometimes you, like a receptionist, are trained to know if something is an emergency that they need to be seen right away for, or to they'll sometimes ask us. They'll come and say, "Hey, this person, you've seen them before." Especially if I've seen someone before in the last year or so, it's easier for me to say, "Well, I know who they are. I trust them. Just get them to watch for these things before they bring them in." But it's a weighing of pros and cons. I'd say maybe even more so in like the bird species that I see. It's stressful for them to come in. And birds can die basically literally of stress. So it's always a hard thing.
I had a Moluccan cockatoo growing up, and he seemed to get depressed. And then once he started going to the vet regularly, everything just progressed so fast. He went downhill and had passed in probably a year or so. And he ended up, it turns out there's a mass in his tail. And he fell off his perch because it had made him so sick and weak, and the vet hadn't gotten that far down the diagnosis line yet. They thought that they were treating him for depression, I guess, from what I understand. I was a teenager when this happened, but he fell off his perch because he had gotten so sick and the mass had ruptured. So that was the point where he was euthanized. But he just, once we started taking him out of the house to go to the regular vet appointments, he just,
it's hard.
And I don't think it was the vet doing anything wrong. I don't think it was vet error at all. I think it was just, we just hadn't gotten that far in trying to figure out what was wrong with him yet. But the stress just caused system overload, probably.
It's hard because, especially with prey species, when they come in, you have to weigh the pros and cons of helping versus harming them. Because each time you handle them, there's going to be some aspect of stress. But each time you harm them, you have the opportunity to do a test or to give them fluids or to give them antibiotics, something that might make them better. So if a sick small bird that comes in, it's one of the first things that I say, your bird may decompensate very quickly, but we don't have a choice because his body's not giving us a choice. We have to.
You either try or you don't. You only have so many options.
Die or die trying sometimes.
And I think that's exactly what happened in the case with my parrot. It's unfortunate because they can live to like 80 or so years in captivity with really good care, and he had good care, but he ended up getting sick and he passed away when he was only 13 years old, and that's really unfortunate for such a young bird.
Yeah, that's sad.
We got a couple more comments here. Mark is wondering, do you recommend quarantine regardless of situation, even if it comes from a reputable breeder?
Yeah, I do. Because like we just said before, it's often no one's fault that an animal has gotten sick, and sometimes they don't show when they're sick at all. So to make sure that the rest of your herd or the rest of your collection stays as safe as you possibly can, like you're never going to decrease the risk to zero. But at least you can know that you waited for some obvious signs to come through, or you took them in and got a fecal done, or you handled them appropriately for those period of time, for that 3 months. So yeah, well, I'd say to quarantine.
And there's cases of people being sold animals with mites, parasites, RI, whatever, for breeders as well. So, it's just something that happens in reptiles. Illnesses happen.
Yeah, I personally quarantine for a minimum of 90 days. And if something does arise, another 90 days on top of that.
Yeah.
After the problem has subsided, if it's like a respiratory infection, mites or whatever, because sometimes I had mites in my collection and that took me 3 months to get rid of entirely. So it's just something that it's a good practice to quarantine for a long time. I don't care who the animals came from. It could be a good friend, it could be wild caught or whoever. I quarantine no matter what.
Yeah, I agree.
Chris says, yeah, I quarantine even from good friends. Something as simple as a transit can cause issues.
And if you're thinking about putting animals together, if you have a new animal, it's not just about disease transfer to your previous animals. It's about making sure that animal's okay. So knowing who's passing which droppings, knowing who's eating what is going to be really important if you're watching to make sure that, just like that person had mentioned, transit can cause issues.
Yeah. Cody also said, mites happen, treat and move on. They aren't always linked to poor husbandry. Yeah. And that's kind of correct, because mites are an external parasite, so you not necessarily know that where they came from. Because some people have had them come from different substrates that they bought or something else.
I was helping a breeder clean bins, and when I got home, I noticed I had mites all up and down my arms, and I was like, oh my God. I stripped down, threw all my stuff in the wash. I still ended up, the animals in one room of my house ended up getting mites, and that was the first room I walked into when I got home. But we treated with Nix. It works. It was awesome. It was not an awesome experience, but it was an easy situation to deal with. It just took a little bit of time.
Yeah, and that's totally fair. We use ivermectin at work.
That's what I used too, and it was amazing. It didn't have a smell, which what I really liked. It was more expensive than Nix, but I think it was a better product in my experience.
Yeah. And one note I wanted to make on expensive things. I know that vet visits can be costly. What can sometimes happen is if you have a huge collection, it's not that you have to bring every single animal in to see the vet and pay for each one. If you have issues at home that you think might all be related, sometimes it requires a site visit. So for clients that have lots of animals, or fish clients that I have, what I legally need is what's called a VCPR, so a valid client-patient relationship. So if I have that, and there's a similar issue that's happening, I can sometimes prescribe medications for multiple animals, but it's just going to be at the vet's discretion as to if it's the same issue or not, or what you can do in terms of having a site visit, how many animals you can see, and how well you can know their collection.
Yeah. Sherry commented, can you guys list the products that keepers should have on hand for emergencies, and cleaning in the link for the podcast so it's great for reference? We can do a list of that. We can do a list of disinfectants, like I've used Verticon F10. I've used chlorhexidine in the past. It's a little harder to find. F10 is not going to be sold in Canada once the supply's up, because I heard that they're having issues with the FDA, so it's harder to get a hold of. So I think chlorhexidine and Verticon are going to be two of the better options currently, unless there's something else that becomes available, which I'm not aware of.
Yeah, for a lot of the time, bleach does a good job. It just does have to have a wet contact time of 10 minutes.
Yeah, and a lot of people just don't like the harsh smell of bleach, especially for animals. So that's...
If you're in a tank, though, that's empty and you do the bleach, you just rinse it really well after. The bleach is working after 10 minutes. You don't have to leave it on there. You can rinse it. It's okay to rinse it after 10 minutes.
Yeah, I've used bleach in the past, but I always did a double water wash afterwards, just so it's not sort of a pungent smell. Sherry also mentioned, I freeze all my substrates before using them. Is that the best way to prevent mites?
I don't know about best way. I know that really cold temperatures can kill mites, but I know that they can be kind of hardy. So I would have to plant a flag here to say I don't know if that kills all the mites. I'm not sure.
Yeah.
It could definitely help reduce the mite load, possibly, but I wouldn't say it's guaranteed.
Yeah. Some people I've heard of baking their substrates for at 200 degrees for an hour and a half or something. Sometimes it's said to help. I don't know for sure. Mark says the same ivermectin we use in cows.
Yeah, it's the same. It's the same. I don't want to say product. It's the same compound, but the ivermectin in the cows is going to be so much more concentrated. So they're
way more concentrated.
Yeah, so because a lot of times, if I'm not mistaken, it's like a bluish liquid that you spritz on their back. But if it's good enough to spritz on the back of a cow, holy, it's going to probably kill your animals. So you just have to know what the concentration is and what the dose is.
Yeah. Chris said Nix works, but since it's not specifically for reptiles, it doesn't have the exact instructions, and the acting ingredient can cause neuro problems.
I didn't know that about the neuro problems.
I'm not sure if that has been researched or not.
Well, that's how ivermectin works. It's something neurological, but for the little critters that you're trying to kill. So it works for them because I think the concentration is so high for how little their bodies are, and that's why there is a maximum dose that you can have, like a toxic dose for other animals too.
Yeah, just with anything that there's a toxic dose for humans and other animals, it just varies on the size of the animal and other factors as well.
How sensitive they are to the compound itself.
Yeah, exactly. Like some animals are a lot more sensitive to lidocaine than others are, so you have to be careful with that too.
Yeah, like reptiles and dogs, at least that I know of.
Reptiles and dogs are about the same dose. Like I use 2 milligrams per kilo if I'm going to be doing some kind of block in a reptile, but I've seen people go quite a bit higher. But birds are ones that are really susceptible to it.
My monitor's waking up. Started running around like crazy.
Has there been any recent advances in reptile veterinary care since the last, say, 10, 20 years?
I already asked that.
Oh, did you? Oh, yeah, that's right.
Yeah, it's hard. A lot of things just get better over time. So we talked about the surgical approaches. So the procedures that you can do from the prefemoral fossa instead of going into the plastron of a turtle. But I think that as the understanding that reptiles can get sick becomes more widespread, I think what we are able to do and what we have practice doing is going to be better. So a procedure that I perform more often now is called an ovariectomy in a bearded dragon. And that's because they have these follicles on their ovaries that they're supposed to turn into eggs, but they don't ovulate. And so they get stuck in a state called preovulatory stasis. And that will end up eventually being life-threatening for them because those eggs, those follicles will get incapacitated or dried, and they will essentially rot within the body and make them very sick. So they have to be baby.
Okay. Yeah, I know that happens a lot in tortoises, some bearded dragons, and I've seen it in some chameleons.
Yeah.
I know some tegus have to have that sometimes because they get egg bound after trying to breed every twice, and then all of a sudden it's just nope, no more, and then they just get rid of everything so it doesn't become a problem anymore.
Exactly.
So another question is, why are thermostats important to prevent burns? Because I know burns in snakes is kind of a common problem too sometimes.
Yes, I think you answered the question. That's why it's important. And to know where your temperatures are in your tank. But your thermometer can help you tell that. It's just if you're away and you need to make it, you can't come back and fix it if the temperature is too high. It can do that for you. Yeah.
And to check surface temperatures, what would be the best way to do it? I use a temp gun personally because I know it's usually half a degree off at most to check my surface temperatures anyway. So I do that for my tegus and my snakes, just to make sure that the temperatures aren't going to get too hot.
Yeah, I mean, an infrared heat gun is the best way to check a surface temperature, but you're going to miss ambient temperature. So I use a digital thermometer for that.
Okay.
I used a digital household thermometer that measures heat and humidity, and I keep that right in the enclosure in the area that I want to measure the ambient temperatures, and then spot check with the infrared gun on the hot spot.
Yeah, that makes the most sense. I think a common mistake that people do is they say, I have a thermometer in my tank. And I say, okay, where is it measuring? And it's often on the side of the tank. So it's not where the animal ever is. So you have to, if you have just one, that's okay, but you do have to move it from cold to hot so that you know what your drinking are.
Yeah, and I just found using the like household ones was so much easier than paying all the extra for a reptile one that I find a lot of the times are less accurate unless you get into like herp stats and stuff like that. I just find a lot of the lower end pet store models of thermometers aren't super accurate. I think Cody McMillan sent me a video and he tested 3 different temperatures with same temperature with 3 different devices, and I think there was like a 5-degree discrepancy overall. So and just it goes to show you that cheaping out isn't necessarily the greatest. You want to find something that you think is going to be reliable and have backups as well. I know with my racks, I have them on a herp stat, but I also have a secondary digital thermometer with a probe on it on the side, just so I can cross-reference the 2 of them and watch for any heat spikes or stuff like that. So always good to have backups in place.
Yeah, more thermometers is often better.
What do you think about sterile enclosures versus bioactive enclosures?
I also think this is more getting on to the outskirts of what we do for the most part in veterinary medicine. I understand the idea of bioactive enclosure. I do think in the right situations they can work. My only main concern is, you're doing it in a smaller area than what Mother Nature has. You don't have UVB, real sunlight coming in. You often don't have wind and different things that is naturally in the environment. So I don't know how good of a job it's doing, but some people have great success with them, and I think it's working well. I have sterile environments just because, to me, it's a lot of work to set it up, and I don't know how to monitor it to make sure it's doing okay. But I have an okay time cleaning my enclosures and keeping track of who's pooping what and what everyone's stuff looks like.
Brandon and I, we both have both types of setups. We're not for or against either. We just do whatever works for the particular species that we're housing. And like most of my baby animals are kept completely sterile, paper towel, just for simplicity's sake. It's easy to find who's pooping, who's having funky poops, did someone regurgitate, just stuff like that. It's really easy to monitor. And then some of my more advanced species, my smarter stuff like the monitor, definitely bioactive, huge amounts of space, really enriching. That's the biggest thing for me is I always want to be able to have an enriching environment, which you can still provide with a sterile environment. You just have to think about different ways to do it.
Yeah, exactly. To get a little bit creative. Things that you might think are boring, like toilet paper rolls, aren't necessarily boring for your reptiles. They're different. Like, they really live in a box. So I do think that enriching environments are helpful. And they've shown, there's studies with, I think it was snakes, where they showed that they are more active the more enriched their environment is, and the more often that you change it. And activity is something that I think captive reptiles miss a lot because they're opportunistic eaters in the wild, right? So if they don't have to move, what's the point? And then you end up with an obese animal, which is super common.
Yeah, like for some enrichment things that I do for some of my snakes and tegus is one animal will shed, so I'll take some of that shed and put it in a different enclosure. So it's a new smell for them to check out. And like my tegus, I might bury it under the dirt, and they'll spend the next 5 hours trying to figure out what that smell is.
That's a really good idea. I put bits of shed in any of my enclosures that have isopods and stuff like that in them. They eat it.
So maybe don't do boas to pythons for shed.
Also with bioactive enclosures, a lot of people think that I'm going to toss some springtails and isopods in there, then I don't have to worry about cleanup again. But it's very similar to fish keeping because there's going to be different acids and stuff like from the poops, and the bugs are going to break stuff down, and it's going to be in that soil. So you always want to make sure that
made a very good post defining all the fine-tune aspects of bioactive setup. We should link that to the page. It's full of amazing information, and it talks about the nitrates and nitrates. Actually, when that dog first ran across the screen, I wasn't paying enough attention. I just saw a little bit of ginger. I was like, did Tuna get in here? I thought it was my cat, because I don't like my cats in here because I have all my seedlings and stuff, and they like eating them and ruining them. So, but he's the only cat that's tolerated in this room because he's just cool. He's like a dog.
Yeah. There's just a lot more to bioactive than just throwing bugs in there and then not cleaning up the poops.
So. Right? The principle of trying to recreate what their natural environment is more like, it makes sense.
Mm-hmm.
Yeah, it does. Well, but there's a lot more to it than what people think. So
yeah, in some ways, once you understand how to do it, I find it really simple and easy. But to learn about how to do it properly takes time. And I've been working on bioactive enclosures for 5-6 years. So it's taken a lot of time to figure out how to do it properly, and mixing different types of substrates together for different types of species. I have some Australian species. Some people keep them on sand. I have a whole bunch of stuff mixed together. Because they do live in a drier environment, but I still wanted to be able to have a little bit of some control over the humidity in the enclosure without having to constantly mist it, because I don't like messing with my animals more than I need to. A lot of my animals are just for display.
Yeah.
So I don't like messing around with them.
That's fair.
Yeah, I have a lot of finicky animals that if you bug them too much, they will go off feeding, or they just won't want to respond to food and other things. So I have some animals where if I leave them alone, they do a lot better.
Here's your food. Here's your fresh water. Goodbye.
Yeah, that's it, pretty much. So
they still are really wild animals, even though we've bred them in captivity for what we think is a long time. We haven't domesticated them like we have dogs. Same.
And I hope that we don't domesticate reptiles. I think that's something that needs to keep its spunkiness. I really do. I have some geckos that are multi-generational captive bred, and they're really handleable. But I've seen videos of them in the wild. They're extremely defensive, gaping. They shoot a sticky substance out of the tail of the defense mechanism, and they're gone like lightning as soon as you come near them. But mine, you just stick your finger in there, and they're like, "Oh, hello, human. I'm a little finger hugger." And I think reptiles need their wild spunk. I really do. I'm really against. I hate the word puppy dog tame used in reptiles, or the phrase. I really, really don't like it, because what do you expect when someone says their 7-foot boa is puppy dog tame? You expect that to be able to do what Brandon's doing right now, and to be able to love on that dog or the snake and wrestle around with it. That snake can easily get scared and be defensive. And I don't want to get bit by a 7-foot boa in the face. Seems like a bad time to me. And especially when it's my own error, because someone's like, "Oh yes, puppy dog tame, you can do whatever." So what if I do whatever and it gets upset and defensively bites me? It's going to be my own fault, but I'm still going to be the one going, "Oh my God, this snake bit me." I don't think it's a good term to use when it comes to reptiles, because reptiles are not tame.
No, they can in every environment too. People will come in and they'll say, "Oh, my snake's never bitten me," but I'm new and they've been transported, and I'm holding them and handling them in a different way than they do. So I still keep control of most snakes' heads. The only ones I've really been tagged by at work are really tiny, because you get not cocky, but you're like, "Oh, cute, what can we do?" And then
It's like my hatchling Madagascar giant hognoses. They bite me all the time. So, but they're also first generation captive bred snakes. So because their parents are wild caught from Madagascar.
The parents are like wonderful though. They're like really handleable.
The adults are super chill, but the hatchlings, I don't know what it is, but they are super defensive, super bitey, and really flighty. But as soon as they kind of hit about the 1 year age, they chill right out. So it's just probably their defense mechanism because of predators or whatever that is trying to.
Well, if I'm this big, I am going to be fighting for my life against basically everything.
Yep.
If a mouse can take me out and eat me, then I'm gonna be extra testy.
Yeah.
And like my Maclots is like that too. But once they hit about the 4 year mark, they tend to chill out a little bit, or 4 foot mark, not 4 year mark. So keep growing, chill out, take your PMS pills.
So, Kelsey, what advice would you give to first-time keepers?
First-time keepers, I think it's always good to get all of the advice that you can get from a couple of different areas in the field. One, of course, I recommend having a consult with a veterinarian if you are getting an animal. Another one would be talking to the keepers that have kept this species for years and years. Both are going to bring different ideas to the table, and then at that point, it's your decision to do what you think is best for your animal. The internet's an okay place. I saw someone mention in the comments a while ago about, I can't remember if it was monitors or something, where they said a basking spot was 90 degrees Fahrenheit. That's insane to me. Reptiles Magazine does that a lot, and I'll often tell people I don't mind it, but I up the temperatures for the most part in the warm in the basking spots. We actually really do what they say. So I'm not sure why. I know a lot of people that keep reptiles in the States totally different problems than we have, because their humidity is for the most part so much higher. And what the temperature of their house is. So they'll say, oh, a 70 watt whatever bulb is good enough for your enclosure. That means nothing if you don't have a thermometer, because I think us Canadians are used to like 19 degree houses. That's normal for us. It's not normal.
Yeah. Well, my monitor's currently asking at 120 degrees right now.
Yeah.
And he loves it. When you read the care sheets for him, none of them have temperatures like that listed.
Yeah.
But it's temperatures that they're known to be found basking at in the wild. So that's what I want to replicate. And when he's in his temporary I just got you enclosure, so smaller, just monitoring while he's in quarantine basically, and he'll eventually go into a huge enclosure. But I know that the lights that I have right now in a small enclosure, there's no way that they're going to heat his full-size one at all.
Yeah.
Or even a portion of it. So I have to make sure I install the proper amount of lighting and that I'm reaching proper temperature gradients in that entire enclosure. So I'll probably have 3 or 4 thermometers just inside that enclosure in different areas, so that I can always monitor the different areas.
Yeah, for new keepers, I often recommend, thermometers seem so simple, but they're so important. It's going to tell you what you're going to do in your enclosure. It's going to tell you how your animal is going to get warm and cold. I mean, having a UVB meter is great. They're really expensive. So I know mine was probably $350 American. But I think Pisces might now rent them out. I don't know if anyone knows anything about that.
Pisces does rent their solar meter. It's the cost of the solar meter. I think it's like $450.
Yeah.
You pay that as the deposit. You use the solar meter, you bring it back, and you get your money back for the solar meter. So it's no cost, but they just want to make sure that they're getting their equipment back.
Yeah, I think that's a great thing to do, because some lights may last longer than you think and some may not at all. Another thing, if you have an animal that needs a UVB bulb, and that's a whole controversial topic in and of itself, but I recommend having a long UVB bulb, especially if your animal is one that needs it a lot, because in the wild, the sun touches everywhere from the tip of the nose to the tip of the tail. It doesn't just come from one small coiled bulb. So having that span the length, or at least 2/3 of the length of your tank, is ideal.
That's the problem, that because Falcor is my probably I'm his fifth owner. So as you've seen previously, he had burns all along his back. So somebody was using a single light bulb to heat his entire body. So what he was going to do is curl up into a ball like they do when they're trying to keep warm. And that's going to create hot spots. So that burned his skin. So especially for larger animals like tegus and large monitors, you want to use multiple lights. And I use a long tube Arcadia bulb that is 36 inches. So it covers his entire body. So he's going to get enough heat and enough UV. So, and I like to use Arcadia bulbs because they also last a little bit longer and they're a pretty good price.
I like them too. I use them in all my tanks as well.
Yay! I'm using a combo mercury vapor bulb thing.
Mercury vapor bulbs are great depending on the animal's size. So if it's
luckily I have a dwarf monitor, so it's a great size for him right now. But like I said, when I put him into the big enclosure, I'm not even using that bulb in there. It'll be useless. I'll be switching to a tube UVB and floodlights.
Yeah, and also there's deep heat projectors too that Arcadia came out with. I use one of those in conjunction with my floodlights because it provides a different type of heat. So it's kind of like a feeling when the sun warms your skin. So it goes deep into the muscle tissue instead of just heating the surface.
I have one of those in one of my boa enclosures, and she is always near it. She loves it. She prefers that over her other heat source.
Yeah, I find it's really nice because it gives them a deeper heat, so then it heats the animal up to their core temperature a lot faster. So that's just my experience with it. It's a great bulb.
I have one in my leopard gecko enclosure. I think it's the same way as a ceramic heat emitter, because I don't understand the physics of how you could get core temperature warmer without having the surface temperature warmer. But
I have a radiant heat panel. Oh. My bad. I got my terminology mixed up. I have a big giant radiant heat panel. I guess it's not that giant.
But according to what they're stating in their advertising for the bulb, it's supposed to heat like deeper heat. So it's more even heat, I guess it would be, versus just like a surface where the surface just gets really hot. But there's more science to it than I understand. So, that answered a lot of our questions. And
awesome.
Canada, do you have any more questions?
I have a really full bladder.
I'll probably end up thinking of more questions later, but that always happens.
I'm sorry if I'm talking and drinking like nonstop water. I would absolutely love to come up with another round of questions and definitely do another interview, I think.
Sure.
Because I think there's such a vast range of things that we could ask and get into. Like a lot of people asked some really great questions today. Maybe certain things we could dive deeper into.
Yeah, totally.
Next time.
Or certain procedures if people are interested in the medicine or surgery aspect. And
I would absolutely be interested in that.
Yeah.
Yeah.
There's a vet in Australia that I follow. I forget what his Facebook page is, but he did the study, I guess, about whether bearded dragons absorb water through their vents. Okay. And they had a bearded dragon that needed to be put down regardless of vet treatment. It wasn't going to survive, so they decided to put it to some scientific use. The vet kept her overnight, kept her well, I don't know about overnight, but I believe she was soaked for 12 hours in a solution with a blue dye. And then after she was euthanized, she was dissected to see how much of that dye was absorbed into the body through the vent, and it was proven to be 0.
Yeah.
So the whole theory of soaking your beardy to hydrate it was completely debunked by a vet. And I just found it extremely useful and knowledgeable, and it's really good to pass on to new keepers that are still reading old information, because there's so much old information out there that we've been taught for years and years. So we think that that's it. That's all. That's just how it is. And a lot of keepers aren't willing to evolve with science.
Yeah, that's true. I've come up against a lot of those ideas in practice. And another one would be not providing, I know I'm going to get into hot water here, but not providing a Euromastix with water.
Yeah.
Yeah. A lot of people do not put water in their bearded dragon enclosures.
That too.
And they just soak them. And it blows my mind. It really does.
And where they think, and mine doesn't drink. I've never seen him drink water. Of course, he could be doing it when I'm asleep. So I get why. But my thought is, if you have an enclosure that is totally enclosed and you have heat bulbs and everything, how dry that is super dry.
Yeah,
if you're in the wild and how they bury themselves a bit, there's going to be more humidity within there. So you're not going to cause rot. You're not going to cause bacterial growth at all by having a water in there. Unless you have a pet rock, your pet should have water available just in case. But also, to get water into them is to buy, if you give them their greens in a shallow dish of water, they're going to ingest more water that way.
Yeah. I did, when I kept bearded dragons, that was one of the tricks that I did as well.
I do that with my tegus too, is a lot of their foods, sometimes I put extra fluids into the bottom so they get more moisture when they're eating them.
That's fair, because live plants are going to have more water than what we get at the grocery store or what we grow at home.
Yeah, exactly.
Yeah, absolutely.
So it's always good to give them that option to get extra moisture.
Yeah.
I just don't understand why people don't provide water for their animals. And because their environment needs it. They need humidity in the air.
Yes. But if I think it's euromastixcare.com. I think I've sent them an email already and they haven't seen it yet. But
I'm glad you're willing to speak up against stuff that is just not correct. It's nice knowing that there's vets out there that care that much.
Yes, I want them to know. I mean, at least I just feel like they're providing bad information to people and they're making animals sick. But there's no fault. It just means that they were not maybe aware,
properly educated.
Yeah.
And that's also another thing too, is some people are just uneducated, but there's also sometimes that people are unwilling to learn or change. So that's kind of unfortunate, but sometimes it's just misinformation that people have gotten from another source. So
and really smart people can say some silly things sometimes too.
Yes, that is true.
You're getting good information from them because they know a lot about other things, but they may just be wrong in that certain thing. I'll plant a flag that my computer might die. I don't know where my charger is, so I'm sorry if all of a sudden I just am gone.
That's okay.
We're going to wrap this episode up anyway, because we're pretty much out of questions for now anyway. How would people be able to find you and some of the surgeries that you do? Because I know you post them on social media.
I sometimes, if the owners give me permission, will post pictures on my Instagram. And I think you guys will probably put a link to that, or you did already on your Instagram. It's at Kelsey R. Chapman. And then sometimes there'll be some other photos on at Calgary Pet Vet, which is our business account. So for Calgary Avian and exotic, but it won't just be reptiles. There's a lot of, because we do all the exotic animals. So there'll be animals and birds, but those things are cool too. So you can follow both and you'll get some knowledge sometimes and just some cute pictures some other times.
Okay.
Awesome.
That's sweet. And also, if you could send me an email of some of the things that you think keepers should have on hand, and we can post that to our page so people have more information about some of the things that they should have on hand.
Sure.
Because there's a bunch of things that I probably forget.
Awesome. Thank you for coming on and answering all our questions and answering some of the viewers' questions and teaching us all about viruses and stuff. It was good.
Great. Thanks for having me.
Thanks for coming on. And I guess have a great day in quarantine, or I guess you'll probably be going back to work.
I have a couple of days off. I just worked about 8 or 9 in a row. So
holy smokes.
Yeah. So Monday, I'm back to work.
That's not too bad. Oh, how's the new procedures with the virus and everything going on with this facility? Because
everyone's
outside.
Outside, like all the clients stay outside and they call when they're there, and then we find a way to get the animal in. And then once the animal's in, the vet will call and say, "This is what I found. This is what we see. This is what we think we should do." And we get it, and they get them back out to the owners. The hardest thing is it's hard to build rapport when you can't meet someone face to face.
Yeah,
and it's hard because some animals, like especially birds, can be stressed when they come in and stressed for an exam. It's hard when something happens and the owner doesn't see and know that either you aren't at fault or it couldn't have been avoided. So those are difficult things when someone's not watching.
Okay. Yeah, well, I guess we'll wrap this episode up. You can follow Kelsey on Instagram. You can follow us on Facebook at chp.podcast, Instagram, chp.podcast, and you can email us if you have any questions or want to be on the show at some point at chp.podcast@gmail.com. Thanks for everybody tuning in, and this was a really informative episode. I learned a lot, and I hope everybody else did too.
Thank you.
Bye.
Bye.
Please turn off the live so I can pee.
Oh, you need to pee?
Yes.
Thanks for tuning in, everybody.
Don't forget to grab Life by the Hemipenes.
That's right. Oh, I should probably turn that on.
Oh my god.
We can do these cool banners. Like
Brandon.
this one.
Come on. That's not nice. That's not nice.
Oh, it's hilarious. All right, everybody. Have a great day. We'll make a post about my surgery. Some stuff that you should keep on
His
hand.
Tegu's surgery, not his. He's not that important.
Yeah. I don't have a tail that got amputated.
Yeah, my butt. Look at this. Look at this.
It's a suppository.
It looks like a suppository from hell.
Yeah, she bought a new microphone.
I bought a expensive ass microphone.
So yeah, the audio's a lot better. There was no cutting it out. It was great.
We fixed it.
Woo! So yeah, that was awesome. Yeah, and we'll make a couple posts about some of the information that Kelsey was talking about, some disinfectants that people can use, some first aid items that you should have on hand just in case, and some other information that might come up probably by tomorrow sometime. So give us a little bit of time to get all that organized and set up. Thanks for tuning in, and see you in the next episode.
Bye, guys.
Have a good day.